Hi, welcome. So in this video we're going to talk about reading a chest x-ray. In particular, this first one we're going to talk about the anatomy of a chest x-ray. So you see here two views of a chest x-ray. This one here is the posterior anterior or PA view, and this one is the lateral view. Typically you're going to get two views because we are turning something that is in 3 dimensions into 2 dimensions, so we're going to need two views to really get the full picture. And so this one is one where you will typically send the patient to radiology to get it done. Now, you can see here, this is a different kind of chest x-ray that looks similar to the PA view. This one is called the AP and is shot anterior to posterior. This is usually when you have someone who is too sick to leave your emergency department and they have to get the x-ray done in the department. And so it looks a little bit different, as you can see. It's not as clear a picture as the one on top, and we'll talk more about that. So let's go through all the parts first here in this PA view. What we got here is the trachea and the 2 bronchi and the carina. And here I've outlined the pleura, which is the lining of the lungs. And here we got the right and the left hemi diaphragm. And you'll notice that the right hemi diaphragm is higher than the left. And I like to think that's because the liver is pushing up on that right hemi diaphragm. At least that's how I remember it. And we also have our right and our left costophrenic angles, which have these nice sharp points. So we should see that, and it should be visible on the x-ray. Then we have our heart with the right atrium, right ventricle, and left ventricle here. And the aorta comes on up here. And this portion here represents the pulmonary trunk. The little aerated space underneath that left hemi diaphragm is the gastric bubble. That's air in the stomach, and so you can see it forms a little air fluid level there. And then we also have the horizontal fissure and the oblique fissure that separate the right lung into its upper, middle, and lower lobes, as well as the oblique fissure in the left lung that separates the left lung into its upper and lower lobes. Let's take a look at some of these bony structures now. So on both sides we have the posterior ribs, which are the ones that are a little bit easier to see, but remember that they also curl around to the anterior side. And so we have the anterior ribs here that are a little bit more difficult to see, but if you concentrate you can see them, especially if you look at them on this side as they curl around like that. And here you can see the 2 scapula, and the 2 scapula we talked about, and then the vertebral bodies here. I didn't draw them through here, but then you can see them here, and of course the clavicles. And now let's take a look at the lateral, where we have the heart here and the aorta. And so we have the 2 hemi diaphragms as well. Remember, the right tends to be higher. This one's the left, I think, because you can see the gastric bubble underneath it. And of course we have the 2 costophrenic angles now seen from the lateral. We have a posterior one and an anterior one. And of course the gastric bubble. And we have the vertebral bodies. And this little space here is called the retrocardiac space. It's lung tissue that's not being obscured by the fluid in the heart. Sometimes we may have pneumonia there that will obscure it. We have horizontal and oblique fissures in the right lung. And we'll also have an oblique fissure for the left lung. And the rest of the stuff in here I'm not going to draw, but you can see we have the bones of the arms there. We have the chest wall. You can see partly the ribs over here as well as over here. And so this is basically what you want to know of the anatomy of the chest x-ray in the PA and the lateral. And you could see it's fairly similar. If you look at the AP, you'll see the same features, just not as clear because of the way the film is shot. All right, thank you for watching. Bye-bye.